Welcome to The Explainer. If you're a nursing student, you already know. The NCLEX has changed. Big time. Today, we're going to crack the code on this whole next-generation NCLEX thing. We're giving you the blueprint to understand exactly how it works and, more importantly, how you can walk in there and totally crush it.
So you did it. You survived years of nursing school, you've got all that knowledge packed in your brain, and now you're face-to-face with the final boss, the licensing exam. And you've probably heard that it's different now. That uncertainty alone can be a huge source of stress. But here's the deal. This isn't just a fresh coat of paint on the old test. It's a complete overhaul. You know, the single biggest change, the thing you really need to get, is the focus of the exam. The next-gen NCLEX, or NGN, is shifting away from just asking you to remember random facts. Instead, it's all about seeing how you apply that knowledge when things get real. Okay, so let's get right into it. This next concept is the absolute key to the whole thing. If you can wrap your head around this one idea, the rest of the exam is going to make so much more sense. We are talking about clinical judgment.
Now look at that definition. It sounds simple, right? But it's a huge deal. The entire exam is now designed to measure your ability to think on your feet, to make safe, smart decisions for your patients in the moment. It's not about finding the perfect textbook answer, it's about finding the right answer for that specific patient, right here, right now.
So the people who designed the test actually gave us the playbook. They broke clinical judgment down into this 6-step process. And get this is the exact framework they use to write the questions. So think about it like a mini-story. First, you notice the clues. Then you figure out what they mean. Next, you decide what you think the main problem is and come up with some solutions. And finally, you actually do something and then check to see if it worked. That cycle is everything. And that right there is the secret sauce. For every single question you see, I want you to stop asking what's the right answer and start asking yourself, okay, which of those 6 skills are they testing me on right now? Are they asking me to spot the clues? Or are they asking me to evaluate what happened after an intervention? Changing how you look at the question is how you crack this thing wide open. So how in the world does the exam actually test this whole clinical judgment thing? Well, it does it with some brand new question formats and a totally different way of scoring your answers. And this is probably the best news you're going to hear all day. The old NCLEX was what they called dichotomous. It's just a fancy word for all or nothing. You were either 100% right or you got 0 points. But the NGN, it has partial credit. This is a game changer because it means your thought process actually gets rewarded, even if you don't nail every single part of a super complex question. To test you in this new way, they had to invent new kinds of questions. You're going to see things like case studies that literally unfold over a bunch of questions, or you'll have to highlight important info right inside a patient's chart. It's way more interactive, and honestly, it's designed to feel a lot more like what you'll actually be doing day to day as a nurse. Now, it is so easy to look at a list of new formats and just freak out a little bit. I get it, but try to flip that in your head. These aren't just new hurdles to jump over. They're your chance to shine. They are built from the ground up to let you show off your ability to think like a nurse, to connect all the dots and make a good call. Okay, so we've got the how down, right? The focus is all on clinical judgment. So now let's talk about the what. What kind of nursing topics will these new questions actually be about? The test is broken down into 4 main categories, which they call client needs. Now look at that chart. The biggest piece of the pie by a mile is physiological integrity. We're talking up to 61% of your exam could be on that one area. The next biggest is safe and effective care environment. This is basically a giant flashing sign telling you exactly where to focus the majority of your study time. The other categories are still important, for sure, but you can see where the real weight is. And when you dig into that huge physiological integrity category, it just makes perfect sense. Look what's in there. Basic care, giving meds, keeping patients safe, helping their bodies adapt. I mean, that is bedside nursing. The exam is testing you on the critical, hands-on work you're going to be doing from day one. So, we know the how, clinical judgment. We know the what, the client needs. The last piece of the puzzle is putting it all together. How do you build a winning strategy to actually conquer this exam? I want you to think about your prep like you're building this pyramid to success. The base, the foundation, is all that knowledge you gained in nursing school. That's solid. On top of that, you start adding layers of test-taking strategy. And what's that final piece right at the very top, the thing that brings it all together? You guessed it, clinical judgment. And really, that's what it all comes down to.
Passing this test isn't about getting lucky, it's about being systematic. Once you understand the framework, the 6 skills, the question types, the content areas, you can build a study system that gets you ready for literally anything the engine can throw at you. So as we finish up here, just remember this. You already have the knowledge. You did the hard part. You got through nursing school. Now, with this blueprint, you have the strategy to prove what you know. You understand how the test thinks, which means you can show it how you think. So the only real question left is, what's your